I want you to move from overwhelmed by information to confident in what really matters. I want to help you move from being unsure towards direction and purpose in your healthcare. I want to introduce you to health experts. I want to let you in on tough conversations on women's health. I want to give you a place where you can lean in and learn how to take care of yourself. Let's transform your health. Let's get clear on your goals. This is Women's Health Unplugged. I'm your host, Dr. Jordan Robertson, naturopathic doctor. Welcome to another episode of Women's Health Unplugged. I'm Dr. Jordan Robertson. I'm a naturopathic doctor, and today I am joined by one of my colleagues and friends, Dr. Olivia Greenspan. Olivia comes from such a unique perspective in healthcare because she's actually worked in the hospital. Now, in Ontario, naturopathic doctors do not work in the hospital. Olivia has been working as a cardiac nurse for the last 20 years alongside her women's heart health naturopathic practice. And I can't think of anyone better to have this conversation with who can hold both things in her hand at the same time. This incredible importance on prevention and education and women's health and empowerment. But this same person also spends a ton of time watching what happens if we don't do anything about our preventative heart health and watching the end stage complications of women I'm going to say maybe ignoring parts of their heart health or missing the opportunity to support their heart health because we tend to not focus on it very much in our healthcare system. So welcome, Olivia.
Thanks, Jordan, for having me.
I'm so happy you're here. I would love for you to tell a little bit of your story. Like, how did you go from working in a hospital, being a nurse, seeing people at that more critical care side of their healthcare journey? I mean, maybe it feels obvious to me why you would want to back up and talk about prevention, but I'd love to hear it from you. Like, how did you make that jump to wanting to help women with preventative heart health as a naturopathic doctor?
So gosh, this was over 10 years ago when I started thinking about, well over 10 years ago when I started thinking about sort of stepping into this other role as a naturopath. And really it started when I was working in critical care. So I was working in the cardiac ICU. And while I loved my job and it was rewarding looking after those patients and seeing them move on and heal and get better, a lot of the patients didn't. And I think it really took a toll on me. And I knew, and we know that cardiovascular disease is largely a preventable disease, but yet we're seeing so many people impacted, particularly women. And not only that, even if patients recover, a lot of them go on to live a life full of disability from cardiovascular disease. And so just seeing that, working sort of in the trenches, seeing the worst case scenario just sort of made me feel like I wanted to do a little bit more and wanted to step on the other side and prevent these conditions from happening in the first place. And so that's when I sort of looked into naturopathic medicine and sort of made that step into that path while still working, of course, as a nurse. I still love my job, but as I started working more as a naturopathic doctor and digging a little bit deeper into sort of like the gender inequalities around healthcare in general and specifically heart disease, that's when I sort of kind of pivoted a little bit more to focus more solely on women. I still see men in my practice, but women are at a tremendous disadvantage when it comes to heart disease and heart health care. And I really wanted to support women in preventing them from having these major cardiovascular events. So that's sort of what's led me here, Jordan.
And I mean, I was just thinking as you were talking about those people in that critical care, because even when we think about someone who's in critical care for their heart, I even visualize it being a man, right? It's crazy because I know what the statistics are, and yet that stereotypical heart patient that's in my head is actually not a woman. Well, what did they think when they were there, at that sort of critical heart health? Were they surprised that they were there? What was their journey like for them to get to that moment?
Well, yeah, I would say a lot of women and even today when I work in cardiac recovery, impacted by heart disease, they are often surprised because we do still think that heart disease is a man's disease, and we know now it's absolutely not the truth, that younger and younger women are actually being impacted by heart disease. So there's a lot of confusion. There was a lot of unaware of sort of their risk factors. So, and we know that a lot of people and women are walking around with risk factors and they don't even know that they have high blood pressure or they have high cholesterol. So sort of that lack of education and unawareness of sort of their histories that have impacted their cardiovascular health. So a lot of sort of misinformation, confusion, was sort of their experience for sure, I would say.
Yeah, I would imagine even they felt like maybe they were the anomaly, right? Like as if you're not
Mhm.
acutely aware that this is a woman's number one health risk in her lifetime. Like number one, and even if we start to add up some of the things that women imagine that they're at risk for, like it still pales in comparison to their risk, their lifetime risk of heart disease. And yet, if you don't know that, you may not, it's not like you're going to feel part of a community when you get diagnosed
Mhm.
with high cholesterol or high blood pressure as a woman. You may actually feel like you're the like abnormal situation, or that you're alone, or that it's like, unique that you've had that experience. So I'm always so curious about that, right? If those women feel isolated or even shame about getting that diagnosis, almost like they imagine that they did something wrong because women aren't supposed to have high cholesterol, aren't supposed to have heart disease. Yeah, I don't know what your experience was of that, but I imagine it to be hard for those women.
Yeah, for sure. And when we look at sort of, we look at menopause and the changes we see in menopause, and we see those cardiometabolic risk factors, the high cholesterol, the blood pressure changes, the blood sugar changes. That's often not due necessarily to anything that woman has done in her life, but just the normal sort of changes we see because of the hormone changes that are happening at that time. So sometimes women think, "Oh, what have I done?" But it's actually, related to the changes in midlife. And as well, when you mentioned, Jordan, about that sense of isolation, and the anomaly, and it being, weird that a woman's had heart disease. It's part of the reason why a lot of women don't go to cardiac rehab too, is that when we think of cardiac rehab, they're doing their mall walks or they're walking around the track with like 60, 70-year-old men, and women don't want to be lumped in with them, right? They have different risks, they have different unique needs, and it's not really enjoyable for them, to be honest. And I've heard that a lot from women, especially the younger women. Like they don't want to be hanging out with those middle-aged men. They want their own group,
They need their
and
own group.
unfortunately, yeah, they don't. They not everywhere has those separate groups that are tailored to women.
So you bring up a good point there around menopause being one of those, we call them like sex specific risk factors, right? That it's like a risk that's associated with women that men are not having that same experience. And it's often those sex specific risk factors that people are unaware of, right? Like I think if we
Yeah.
asked women, they might say, well, if I had a family history of heart disease, I might be more at risk. Or if I personally have diabetes, I might be more at risk. But there's a whole bunch of sex specific risk factors that deserve this call out so that women can advocate for themselves and get testing when they need it. Can you walk us through some of those most common ones and what women actually should be looking out for?
Absolutely. So one of the big ones I would say is definitely conditions in pregnancy. Pregnancy is a huge stress test on a woman's heart, and it often brings out a woman's vulnerability to risk factors and their risk for heart disease. And even if after, they deliver their child and things might return to normal, blood sugar might normalize, blood pressure might normalize. They often think that that risk goes away, but in fact, they actually have an elevated lifetime risk of cardiovascular disease that they may not even be thinking about. Their healthcare provider may not be asking them about it. So it's really important that we really pay attention to these windows of opportunity for women. So gestational diabetes, pregnancy induced hypertension, preeclampsia, even low birth weight babies. frequent miscarriages can all relate to a woman's cardiovascular risk down the road. And I think a lot of times, Jordan, these women are missed in terms of early intervention. Perhaps these women need more frequent screening or earlier screening than a woman who doesn't experience these conditions in pregnancy. It's a really neglected window opportunity. I think one of the many that we're missing the boat with women. And I mean, there's lots of barriers, Jordan, to women not getting that follow-up in a timely manner, especially in that postpartum period. They're not concerned about their health. They're concerned about their baby's health. And there's that energy component and access. And so there's lots of barriers along with that low perceived concern or risk for their heart health at that time because things have normalized. So there's lots of barriers to women accessing primary prevention or early prevention, both from the women's side of things, but also healthcare practitioners, I think, are missing the boat sometimes. And there's not clear guidelines on how to necessarily follow these women. So we're sort of, missing that opportunity for those women that have had conditions in pregnancy. So that's a key one, Jordan. And then we briefly talked on menopause. So I would say, early and premature menopause as well impacts women. As I had mentioned, some of those cardiometabolic changes, those lipid changes, blood pressure, blood sugar changes we're seeing around menopause for women who enter into early menopause or premature menopause are going to experience potentially those changes earlier on. So the exposure of a risk factor over time is going to impact their overall risk as well. So making sure that those women get timely treatment and proper screening and earlier screening is really important as well.
You brought up so many cool things there that I think are worth calling out. Like one of the challenges we have in getting people excited about their heart health is how long it takes for things to manifest, right? So it'd be different if left the hospital with your baby, your blood pressure normalized, and then 3 days later something happened, right? If you turned purple 3 days later and we're like, oh, that's from your heart health, like you'd pay attention. But it's those micro changes over time that are accumulated over years and decades that actually make the difference. And so, yes, at 32 years old, if someone has had a pregnancy related complication, that person sitting beside another 32-year-old person, like their age matched risk in that moment is actually still pretty low, right? Like we don't see a lot of 32-year-old people having heart disease, like frank heart disease or frank complications. The problem is that 32-year-old would like to live until they're 92. And so that cumulative risk over those 60 years, that's the math, right? Over those 60 years is the problem, right? Not that on that one day that she had that experience that she's necessarily at more risk. It's that her projected lifetime carrying around that risk factor is actually what creates the problem. And that's hard for us to communicate, right? Because, it's something that's so far in the future and maybe not something that feels that topical or that important. But like, interestingly, if we can teach women about that at 32 before she leaves the hospital and just say, hey, we got to pay attention to this part of your health, like her long-term outcomes and her long-term health are actually different. It's that we're not having that conversation. What do you think?
Yeah, I agree 100%. And I mean, when people are walking around with risk factors, I mean, they feel fine. High blood pressure, you don't know that you have high blood pressure unless it's extremely high and you're getting, organ damage or you're getting symptoms. High cholesterol, blood sugar, you're not necessarily feeling bad. So you're not going to be, investigating or having these conversations earlier on. But yet we know there's so many women walking around with elevated blood pressure and cholesterol and don't even know it. And if women are doing it for themselves, we know that maternal health is going to impact, their children's health as well. So I always encourage patients to if you're not doing it for you, we got to do it for your kids as well, and setting the stage for their health, because we know maternal health will impact their offspring as well, even after, they've delivered the baby. But I sort of lost my train of thought there, Jordan.
That's okay, because I wanted to circle back on something there that you said. And I feel like there's like a bit of a deeper conversation here about like women's health and self-care and Do we use the word neglect a little bit? Um, it's funny when I think about women that used to work with in my office and like gesturing to the chair that they used to sit in my office. I would often hear women speak about supporting their partners with
Mhm,
their heart health. Like, well, my husband has high cholesterol, so we only eat red meat twice a week. Or my husband has high blood pressure, and so we've created a salt restriction plan and we're using salt replacement already because he has high blood pressure. And I would hear these stories about how women are cooking differently or supporting their partner or going for nighttime walks for their partner. And actually, when I recall, like even thinking about my grandma doing like specific cooking for my grandpa who had heart disease, like very rare do I ever see that woman saying, "I'm doing this for me.
mhm,
I'm doing sodium restriction for me. I'm going for a walk at the end of the day for me." Like she's quite often like, and her partner, within 5 years is about the same age as her and certainly has risk too, but it's not very common that she was doing those things for her. She's doing them
mhm,
for someone else. And I
mhm.
find that so fascinating because, if we teach women about the behaviors and the things that they can do in their 30s and 40s to help prevent their heart disease, like I don't know, do they know enough to do it like for themselves? And are they gonna value their own health enough to do it for themselves? Like, is there a deeper thing here around women just in general neglecting their health in for the sake of other people?
Yeah. Well, it's funny that you talk about that, how women taking care of and cooking for their husbands, because one of the earlier conferences, like it was, decades ago, by the American Heart Association, was talking about like the way to a man's heart, and it was like taking care of his heart by serving him like low sodium food and low cholesterol. So I think like just there's so many pressures on women. There's those gender roles of women taking care of the family and their partners and their kids, and often, neglecting their own health until there's a health crisis. And that's what I see in my practice is that, even though I can talk till I'm blue in the face about the bad things that can happen and not to, put fear in women, but I see what happens on the other end of that spectrum when we neglect our health. And we can't prevent everything from happening. We can't prevent every heart attack or every stroke, but we know that there's so much that we can do to intervene and change that trajectory. But yet women, we often put ourselves last. We take care of our families first. Maybe we don't feel worthy of showing ourselves, showing up for ourselves in that way. And at the end of the day, women are, they have careers they're juggling as well. And so it really makes it hard in a number of ways for women to make the changes they need to make, to find out the information, to book those appointments they need to do, to go to cardiac rehab if that's what they need to do. Um, so it takes women need a lot of support and like cheerleading to make those major changes, I think.
Yeah, I agree with you. It's funny, like maybe in 2025, the Heart Association conference will be like the way to a woman's heart. You need to make your girl this low sodium soup, right?
Yeah, yeah, exactly, exactly.
Let's hope, right? Or
Yeah.
the way to the man's heart health, get your own dinner.
Yeah.
But I agree with you. And I think, we often watch women, with that sort of like superwoman experience where we could like saw off her leg and she'll be like, no problem, I'm in charge of carpool. And and so when we're asking her to do something, or maybe she just has the perception that we're asking her to do something with heart health. And I want to talk about how simple some of those strategies actually are in a second. But, if something is not, severing an artery, it can really easily feel like it's something that gets put on the back burner. And
Right.
then on top of that, like you mentioned, we don't actually have good guidelines for how to track women in this phase of life to give her the warning flags that she needs to know that she's on a path towards heart health. Like I imagine women like leaving the hospital after having a baby. They do well baby visits with their family doctor.
Mhm. Mhm.
They themselves may have a PAP every 3 years. We're not really doing a lot of annual physical exam any longer. They
Right.
technically don't really qualify for annual cholesterol screening unless they've been like flagged in the
Yep.
past. and they're like okay-ish, and so they never go to the doctor.
Yeah.
And so, what is bringing that woman to a place where she actually gets tested? Is it her 50th birthday? Is that she has a family member have a heart attack? Like, what actually gets her in the door? And she might be 15 years too late to have some of those things looked at by the time she like feels the pull to go see her doctor.
Some of the things that I've seen with the women that come into my office is they do have a significant family history that has scared them. So they've had, a parent that died in their 50s of a heart attack. And so they do feel a lot of fear and they do want to do something, but there's so much information out there on social media. Some is good, some is not so great. And it's hard to know when there's so much information and there's so many things that we can do to prevent cardiovascular disease, that it's hard to know where to even start. And so women will start and then they'll get overwhelmed and they're not sure if they're doing the right thing, and then they just give up altogether. And so women will come in to my office and we'll have that conversation. Or we're starting to see those changes on labs where now they have elevated cholesterol or they have elevated blood pressure or they're pre-diabetic and their doctor has said, okay, the patient doesn't really want to go on medication right away, right? We want to put that off as long as possible, understandably so. And so their doctors will be like, okay, right, we'll give you 3 to 6 months to go, do your thing, do diet, do lifestyle, off you go. And they're not given any direction as to what that even looks like. What are the best things that are going to give them the best bang for their buck? And so they show up in my office. Then we have 3 months, or we have luckily 6 months to sort of turn things around for these women. So those are a couple common scenarios that I see with patients, or, their doctor does really want them to take a medication. And so they just want another opinion. They want more conversation. And so, yeah, those are sort of the scenarios I see that bring women into my office.
Yeah, because most of that stuff can't be accomplished in like 5 or 6 minutes, right?
Yeah.
Like, let's be honest.
Yeah.
And I mean, arguable how much health can actually be done in 5 or 6 minutes, period, now. And, I'm so curious about the research right now for women's health is so much around provider time that I'm
Mhm.
curious whether that's ever going to change policy. But the number of things we miss and the number of misdiagnoses and the number of like poor interactions people have if their health appointments like under 10 minutes
Mhm.
is really significant. But to even have that conversation about nutrition or exercise, etc., and in a really short window of time, like we're asking the wrong thing of the conventional system if we're asking for them to provide like a preventative heart strategy,
Mhm.
really. Um, but luckily, like the things that people need to do or that women need to do are actually not, I mean, they're not heroic, which is so interesting. I think,
Mhm.
maybe we have this poor perception of what health and wellness looks like because of the internet, because things are crazy on the internet. Except for Olivia and I, we are not crazy on the internet. So
No.
just follow us and everything will turn out fine. But I think we have this perception that like doing a heart healthy plan means a lot of sacrifice, a lot of time, a lot of Tupperware. And yet I'm not
Mhm.
sure that like that's actually what's required. So walk us through like what are some of those preventative things that people can even start to think about when they think about their heart health?
Yeah, I agree. There's a lot of sort of fancy things going on out there, and I feel like, I really try to keep things as simple as possible for my patients instead of making it super complicated, because then it just gets overwhelming. If you're loading people up with a bunch of supplements, it's hard to stick to. So just keeping it really simple. Of course, we always have this ideal plan in mind that we want people to be moving, every day, 30 minutes a day, but we also have to meet the patients where they're at. And for some people and some women who are juggling family life and careers, and they're looking after aging parents and responsibilities at home, that can seem really overwhelming, even if it seems simple to us. So, when it comes to exercise, for example, even just moving a couple days a week actually does have meaningful benefit. Yes, moving every day, getting your 150 minutes of aerobic activity, sure, that's a wonderful goal to reach for. But realistically, for some women, that's just not going to happen. And so supporting women and realizing that even if they're moving on the weekends, if that's the only time they have, is to get them to move on the weekends. 1 to 2 days a week is still going to have benefit for them. So keeping it simple, starting there and working up and making sure that women are getting both aerobic and resistance training in as well. And we know, Jordan, I know you're a huge proponent of lifting heavy things and building muscle, which is really, really important, especially as we age, but trying to incorporate that in as little as like 20 minutes. It doesn't have to be an hour. But if we can get women starting once a week for 20 minutes, lifting some weights, that's going to make a meaningful benefit as well. And also the benefit of being a woman when it comes to exercise is that they don't necessarily have to work as hard as men do to get the benefits for reduced risk for cardiovascular mortality or just death from any cause. We know that women will reach sort of their peak survival benefit earlier than men will. So that's kind of a nice bonus for being a woman, right? We don't have to work nearly as hard. So just keeping those things in mind, keeping it really, really simple is really important. And then, always, working on diet. Of course, we hear Mediterranean diet all the way, huge proponent. You don't have to be, so Mediterranean being a plant-based, plant-forward diet, you don't have to be vegan, you don't have to be vegetarian, but really incorporating more of those plant-based foods because of the fiber, because of the higher potassium content. We know it's really going to impact cardiovascular health. It doesn't mean you have to restrict diet and pull things out of your diet and go gluten-free and dairy-free and all the the fun things, pulling them out. Just keeping it really, really simple and really trying to focus on what to bring into the diet rather than what to exclude from the diet. So making sure high fiber foods, adding a little psyllium in if that seems appropriate for a patient, or, oats, whole grains. We're not talking about super low carb diets or anything like that. It's just a well-rounded plant-based Mediterranean diet is what I talk to my patients about. And I always get them to sort of score their diet a little bit to see where they're at, to see, okay, are you getting beans and lentils and those plant-based proteins in your diet, and having the patient kind of decide and identify sort of where they can work on is helpful. And if that's an area that makes sense for them, because some people are like, hell no, like I'm not going to start eating tofu or soy, like forget it. Don't even talk to me about that. So that's fine.
I'm so glad you brought up the scoring because when we research something, so it's funny, like when we watch things happen like on the internet, right? Which is like very black and white, very all or nothing, very extreme. And even when we work with patients, and Olivia, I'm sure you've had this experience, patients are also black and white. They're like, just tell me what to do and I'll do it every day. I'm like, no, you won't.
No.
Let's start there. No. But we imagine that that's what it looks like, right? And if we mess up, then psychologically, we have a very difficult time continuing. Even if we just have one blunder, we have one missed day with our personal trainer, cancel the whole thing. This isn't working for me. But the reality, when we do research on these things, we're talking about like the level of adherence, right? It's not, you don't get kicked out of the study if you miss a day on the Mediterranean diet. You are still in the group that's eating the Mediterranean diet. We just rank how much adherence you had. And we certainly know that if people adhere high, right, to the diet, to their exercise, they have better benefits. But often we're also seeing that people have a medium adherence are still benefiting. And even people who sometimes have low adherence to certain aspects of nutrition or exercise, they're still benefiting like over whatever they ate or did before. But our vision of it as a patient is like, if I don't hit this out of the park, I might as well not try. So we don't want you to feel doom and gloom about this fact that you walk out of the hospital at 32 and now you've got this risk factor you have to carry around for the rest of your life. Yes, it takes a very long time for cardiovascular disease to like manifest. But in a way, that's actually a relief because every single day you have this opportunity that you can do things that reduce it, right? Like your olive oil, like your nuts, like your
Yeah.
exercise. So it's if you mess up, it's fine. We've got 60 years of cumulative nutrition we're trying to work on here. It's that if we don't try at all, that we have the problem.
Yeah, I'm so glad you brought that up, Jordan, because like you said, yes, it takes decades to manifest cardiovascular disease. And I think, yeah, women, well, patients in general have this all or nothing mentality. I see that with the exercise piece. That's why I encourage them, like something is better than nothing, right? Especially if you're a sedentary person, you're not doing anything. That like a 20-minute walk once a week is something that's going to benefit. And it's layering these habits and doing it over a period of time, not doing everything at once, because we want these habits to stick and we want to stack them over time. And it doesn't mean if you have a bad day, you have to throw the baby out with the bathwater. And I see that with diet too, right? Like they had, terrible diet on one day, or they messed up, and then it's cake for dinner and everything else. And they feel badly about it. They like really feel shame and around that mistake or whatever you want to call it. But it's cumulative benefit over time, and just keeping that in perspective, that if you have a bad day, it's okay. I don't take some supplements that I'm supposed to take and I know better, right? Like, I
Yeah.
like sour cream and onion chips, and yes, I've been known to sit down and eat a whole bag, but whatever. Like, it's an overall pattern that we're trying to achieve, right? So
Yeah,
yeah.
I love that term. I've always like we've talked about that before on the podcast, but it's like dietary pattern is
Yeah.
it. It's not the one cupcake. It's like
Yeah.
where does that fit in the context of everything else, I think is so important. How do women approach this conversation with their healthcare provider? So, I mean, I hope that we've painted this picture of like you need to take early steps. You probably are carrying around some sex specific risk factors that you didn't even know about.
Mhm.
Slash, all women are going to move through that menopause transition at some point, and that also is a sex specific risk factor. How and when do we start to have this conversation with our healthcare providers, given that the system's not actually set up to do those checkpoints for women?
Um, your next appointment with your doctor, you're going to have this conversation if you haven't already. Um, yeah, like any opportunity you're with your healthcare provider, like asking your doctor, your healthcare provider, your naturopath about your risk, and making sure that your healthcare provider knows your history. And maybe you've changed providers, and I know that's happening a lot. Lots of people are without a family doctor. And so, as soon as you get that opportunity, or if you haven't had your screening in a while, like I see lots of patients, they haven't seen their doctor in 4 or 5 years. And then that's when we're seeing those changes that need to be addressed. So making sure that you ask your, healthcare provider about your unique risk, especially if you've had the things that we've talked about, such as those pregnancy related conditions, premature menopause. You're in that menopause transition. That's a beautiful opportunity to really step back, take stock, understand what you can do, what you have control over, how to make steps forward to improve your future cardiovascular health is really important. And if you don't have time with your family doctor, asking them for resources and direction. One really great resource is that specifically dedicated to women's cardiovascular health is the Canadian Women's Heart Health Alliance. So through the Ottawa Heart Institute, it's a great resource in terms of easy to understand information about risk factors, how to address them, diet, movement, and so on. Things that we haven't even talked about today. I mean, this conversation is could be carried over
Huge.
days, I'm sure. But those are some of the key things. And if you feel like you're not being listened to, like seeking out a healthcare provider, a naturopath who's, well versed in cardiovascular care, specifically for women that you can have those conversations with. More and more women are accessing menopause certified practitioners, and they're going to be a great resource to ask questions to and understand your risk and what you can do, and what time to intervene. So hopefully hopefully that's
Those are
some.
great answers. And actually, I was going to call out the like when you change providers,
Hmm.
like talking about your pregnancy history is incredibly important, regardless of how old you are right now. It's funny, when
Yep.
I ask women, we're like, how are your pregnancies? They go, oh, the baby was 7 pounds, 8 ounces. I'm like, yeah, okay, that's nice. What about you?
Yeah. Yeah.
And they're surprised, right? That they could be, 52 and I'm asking them about their preeclampsia, or if we thought
Hmm.
maybe they have gestational diabetes, but perhaps they actually had their kids in a different country and the screening guidelines were different and they maybe weren't caught properly.
Hmm.
There's lots of things about your history that really need to be relayed to your midlife practitioner, whoever that is, because
Hmm.
all of that cumulative risk over time should change when we test you. And you really, if you're carrying around any of those like really significant health experiences, and you're on the cusp of being screened for cardiovascular disease, that would tip us into thinking you deserve to be screened right now. And so that missing piece of information for a new practitioner that has never met you is
Hmm.
incredibly important so that you can actually get categorized properly, because that puts you in the camp of people that we're going to test early. And that's incredibly important.
Absolutely. And if you have a significant family history as well, that's really, really important. So if you've had a sibling or a parent um, who's had a cardiovascular event before the age of 65, if it's a woman, or 55 for a man. And we're not just talking about a heart attack. We're talking about maybe they have angina, or maybe they had an abnormal stress test. They went for procedure and they found that they did have plaque in the arteries and required a stent, or maybe it was a stroke. We need to pay attention to those things. Those are definitely red flags that we need to pay attention to, and that your healthcare provider needs to know. I mean, I think most healthcare providers are good about asking that family history, but it's really important because as women and patients in general who have that significant history may need additional testing as well to help stratify risk and understand their unique risk and when to intervene and so on. So yeah, I think those are all.
Really important.
Yeah.
Um, Olivia, I want to love to hear like your final message for our audience, but also how they can find you. I love what you put out on Instagram. I feel like it's so practical. It's so no nonsense, which is just my favorite. So share where they can find you, but also if you have any lasting words for our audience and how you want to leave them feeling about today's topic.
Yeah, so I really just want people, or women in particular, to feel empowered about their health, and that sometimes we really do need to advocate for ourselves. We need to ask sometimes the questions of how to get information or what we need to do, rather than just taking a back seat and just letting that information come directly from our providers. We do need to advocate for ourselves more so now, I think, and feel like this information is not all doom and gloom. I feel like every time I talk about women's heart health, it just feels so discouraging. But I really want to flip that a little bit, that narrative, and just think knowledge is power. And the more information we have about cardiovascular disease in general, about our own health, we can really use that to make the next right step and get that screening if we've been neglecting that the past couple of years, or make some of those small changes with regards to diet or movement that maybe we've been putting off or making excuses and getting out of. But really carving out that time for yourself is really, really important. So you need to put yourself at the top of the list of the things that you need to accomplish. People can reach me online, like through Instagram. So Dr. Olivia ND, and my website, oliviagreenspan.ca, is how people can reach out to me.
Amazing. And we'll put those links in the show notes so you have a quick access, but you're such a great Instagram follow. And especially if you're in that like over 35 age range and you're starting to think about heart health, which again, like we said, is your number one health risk statistically
Mhm.
in your life. Just connecting with people who are having this conversation can help you realize how important it is and also how small those little steps are that you can take every day that make a tremendous difference. Thank you so much for spending time with us, Olivia.
Thank you, Jordan.
I hope you enjoyed that episode of Women's Health Unplugged. My goal is to help you feel more confident about your health. Please remember that what we talked about today in the podcast does not constitute medical advice. nor was a doctor-patient relationship formed. If you have questions about your healthcare or about how today's topic pertains to you, please take it up with your family doctor, your specialist, or someone on your health team.